New recording that for today we will be only voice to hear to understand the basic of dentistry. Dentistry is a very important science. And today we will be capturing subjects in great detail. Hope this subject will make you happy. Very crucial for education and educational behavior in class. Hope you're listening to this lecture for history or history of the patient, inquiries necessary for tobacco, drinking, anxiety, and the patient attitude dental. Certainly, the patient with poor oral hygiene should be inquired to demonstrate inability to carry out home care before starting comprehensive dental treatment. So this is an operative, a very important subject for this audio, giving the audience, the targeted audience, and subjects, operative dentistry only voice, and later we will discuss not only voice but also the streams will perfectly well. We shall continue to the subject of our lecture. Our lecture today, as I said, is about operative dentistry, only voice, and later there will be videos and a commentary on many different dental topics. These topics will continue on throughout this week or maybe experience or educational study in order to watch all of these videos and make a let's go ahead and start our inquiries thinking. This first paragraph is talking about the patient attitude toward treatment, whether the patient is able to receive the treatment. Next is the chief pain, is number 5 in our study. Chief complaint, the dentist should be listening carefully to the patient, explaining, complaining of the condition. This is a very important thing to do for the dentist, is to listen carefully for the patient while doing the operative procedure. In order to obtain detailed description of pain, the dentist should record the type of the probing, throbbing, radiated area, initiation factors, or pulsing. Even a pulsing pain could be indicated of some type of pulp irritation. But the throbbing or sharp dull radiated are all types of dull, of course, being with a blunt object, sharp with a object like sticking or a needle, throbbing, throbbing. Throbbing is means like pulsing, pulsing or radiated area. Radiated is like radio or in a way of very going everywhere to the patients. Initiating factors, duration of pain, relief by analgesic or not. Of course, through this hearing we are conducting today, we don't need to watch any visual for this important live stream, as you can only hear it through microphone, and you can go do any other business as usual. Let's check the network is working or not. Is working. Not. Yes, the network is working, and it's obviously just one person watching this dim or dark live stream. We shall write something in this dark live screen. We should add a text. Yes. And we should add it middle of the page for people to hear it and understand it. Let's go back now to the chief complaint of the patient. Could be of chief complaint that dentists should listen carefully to patients in the condition of pain or detail, description of pain dentistry for the type of pain or sharp throbbing radiated area, initiating factors, duration of pain, relieved by analgesic or not. Very clear, we don't have to explain that. Next, examination and diagnosis have the extraoral examination. The dentist should note the presence of facial asymmetry. Here we have. Let's check the voice again. Walking. Control. Shift. Control. We are back now. We just tried one. Now we continue. We are only voice lecture. Next, we have the examination and diagnosis. this page, we will read about the patient. First, extraoral examination, intraoral examination, and of course there are more examinations like local anesthesia, patient reaction, and more. Examination and diagnosis. We examine the patient extraorally, as the dentist should know that the presence of facial asymmetry, lymphadenopathy, facial swelling, exophthalmos of the eyes, flicking of the temporomandibular joint, color of conjunctiva of the eye, the lymphadenopathy being lymphatic gland enlargement. These are all types of extraoral examination, as the dentist would note the presence of facial asymmetry, lymphadenopathy, facial swelling, exophthalmos of the eye. Let's translate what does it mean. Exophthalmos of the eye. Exophthalmos of the eye. For the eye to be exophthalmos, is that the eye being discharged or protrude facially, being very clear and very enlarged in shape. Clicking the temporomandibular joint, color of conjunctiva of the eye, all are parts of the examination of and diagnosis of the patient mouth. These were the extraoral examinations. We said something about exophthalmos of the eye, facial swelling, lymphadenopathy, clicking of temporomandibular joints. Also, color of the conjunctiva of the conjunctiva being the place very important for the eye health, and we can check the color of the conjunctiva, and these are all parts of extraoral examination of the patient, noticing as we will see in this, can you see here picture, we can see, you don't have to see it, the picture, it's a voice only lecture, but you have the option to watch it. I will describe it. The conjunctiva color being a discoloration of the, when the patient lifts his eyelid, watching upward in supine condition, the conjunctiva translucent and clear, and the pink color, the palpable conjunctiva due to the syllable. It should be white, clear in all cases, but sometimes red or yellow, different diseases, hepatitis disease. Some people can watch this with the video, and most people don't have to, because it's a voice only video. Let's move on to the intraoral examination. The intraoral examination of the teeth include soft tissue, oral hygiene, periodontal condition, incidence of caries, and missing, extracted, or unerupted teeth. Again, missing, extracted, wear of the teeth due to attrition, erosion, abrasion, the presence of facets of the teeth. Of course, some people can ask what the meaning of facets. Facets is just like the part or wall, margin, you would say. Only the presence, whether it is abrasion, whether it is erode, whether it is attrition, and all of these are parts of the teeth that should be recorded. In addition to that, the dentist should observe the limit of mouth opening. The limit of mouth opening is crucial. Some people have bismuth, limited mouth opening. Right here, I just some research about limited mouth opening. And we can see here it's called a common health problem that is due to tumor hygiene, drug, rheumatoid arthritis, problem with TMJ, many all could cause limited mouth opening. Apart from intraoral examination, to determine the health of one. That's more. Of course, dentists should observe the limits of mouth, fissuring of the tongue, ulceration of the tonsils or tonsils. Any ulceration could indicate a corona disease, a flu symptom, or any other information. Pharynx should be examined. Mucosal change observed in association with the leukoplakia, which is related to tobacco smoking, should be recorded. The gingiva examined to inspect the presence of pocket, which can be a pocket marker. I used to do this with the periodontics as I check for periodontal diseases, periodontal pockets inspection. smoking and having is by pocket mark calculus should be recorded if present. This is a very important concept of the to know that the calculus also the periodontics. If I say it periodontics, no one would understand it. So that's why I'm yes. The gingiva examined to inspect the presence of this pocket mark. And let me add, or I don't want to name this video only voice. Also, always ASMR, which is very nice. Let's see. Some people understand it, but most people wouldn't. That's just. Let's check if the voice is still clear and going well. Meanwhile, studying. Still clear and going. Voice is good. The calculus should be recorded as present. Presence, absence, appearance, mobility, and sensitivity of the tooth also noted. Presence of hyperceramic gingiva due to the local causes such as overhang, inadequate margins, or poor contact of restoration with the adjacent tooth or caries should be taken in consideration. Palpation of soft tissue. This take in consideration palpation. Soft tissues are the areas overlying the apices of the teeth. Apices is the plural form of apex. It's important to know there is an overlying apices soft tissue at the area. Palpation. I don't fully understand palpation, but moving on. Tapping vertically and laterally. Excuse me. Change inadvertently, so the page any further to do. Tipping of finger vertically and laterally will locate the tender tooth. Biting where the patient presenting pain. Anyways, says here like I think it is percussion gently. It's only a test of percussion, tipping with fingers where the patient presenting pain due to the chewing without evidence of any periapical inflammation. May be suspected of fracture. Pulp testing, which used to decide whether the pulp is responsive or not. Pulp testing, which used to decide whether it is responsive or not, and includes pulp testing. Number one, or for pulp testing, A, electric anesthesia, thermal. Pulp test with heat, we should check the pulp is sensitive. Thermal pulp test. Heat by using the heated end of the gutta percha and apply to the suspected tooth or